Shifting focus now, nursing homes and rehabilitation centers are often vital for recovery after being hospitalized.
But as I-Team investigator Adam Walser tells us, people who suffer a serious illness or injury can be shut out of these facilities because of a drug addiction, even though that may violate federal law.
You still play?
Yes.
Oh, good.
Using a walker with wheels to guide his wobbly legs, Mariano Delgado slowly slides onto a bench in front of his keyboard.
You need a hand?
I'm all right.
Okay, I don't want you to fall.
I already fell several times.
He says it's the first time he's played or smiled since spending more than a month in St. Joseph's Hospital. Delgado is a recovering drug addict who started using narcotics while playing music in New York jazz clubs decades ago.
Yeah, I didn't want to use it no more, and I'm done with it.
Delgado suffered a stroke while trying to detox cold turkey from fentanyl.
It paralyzed me on the right side of my body. I couldn't move my arm. I couldn't move this leg whatsoever. I couldn't move my toes.
When it came time for him to be discharged from the hospital,
No nursing home would take me. And I asked her how many nursing homes had they called? And they told me in my face, 362 nursing homes in the state of Florida.
You're not able to take care of yourself.
No.
You want to be in a nursing home.
Yes.
There are not many people who say they want to be in a nursing home.
No,
Why do you want to be in a nursing home?
So I get rehabilitation so I can learn to walk and take care of myself.
And those facilities are under no obligation to take people in.
USF Healthcare Vice President Jay Wolfson says while hospitals are required to treat patients with life-threatening illnesses and injuries, the same is not true for long-term care facilities, which often exclude people with drug use histories.
For two reasons. One is the potential liability, and the second is the potential public relations problems of the word getting around that those folks are in this facility.
A spokesperson for Baycare, which operates St. Joseph's, says patient placement is often challenging, saying, unfortunately, the need is so great that there is a constant waiting list of people with both medical and psychiatric needs who need ongoing care. Meanwhile, there continues to be a national shortage of workers throughout the healthcare industry. Attorney Sally Friedman of the nonprofit Legal Action Center says that's no excuse.
So when a nursing facility refuses to take someone because of their history of substance use disorder, that's essentially denying care because of their disability.
Friedman says facilities legally can't refuse admission or treatment to patients with opioid use disorder, but they routinely do it anyway.
They've generally gotten away with it for years, but that is starting to change because the Department of Justice has really come down on this kind of conduct and entered into settlement agreements with nursing facilities in a number of states.
Delgado was sent home from the hospital in a diaper for incontinence brought about by his stroke.
Are you able to change your own diaper?
They only gave me one diaper. I'm still waiting to find somebody that I could pay them $20 to give me a shower in my own bathroom and watch me and hold me up.
Friedman says that's inexcusable.
This is a chronic medical condition, and they would never do the same thing for someone who came in with diabetes.
I needed consistent therapy in a therapy place, in a nursing home where they could watch me and take care of me. That's the bottom line, and they denied me that. Right now I'm nervous.
Okay, hang on.
I'm I-Team investigator Adam Walser with photojournalist Randy Wright taking action for you.
And we contacted AHCA, which regulates nursing homes and rehabilitation facilities here in Florida, and the Florida Healthcare Association, which is the trade organization which represents long-term care facilities. Neither responded to our questions.
And if you've been denied admission to a nursing home based on past drug use, we've provided links to helpful information on our website. Go to abcactionnews.com. And looking ahead, thousands of families across the Bay Area have been touched by addiction. On Monday, our I-Team brings us an in-depth emotional look inside the ongoing opioid crisis. Personal stories from those now sober, surviving family members speaking of heartbreak and hope, and law enforcement taking a new approach. And it's all an effort to save lives as the death toll fueled by fentanyl overdoses continues to climb. That's Monday night at 5, 6, and 11 on ABC Action News.